My name is Ali Araghi. I'm an orthopedic spine surgeon. I work at the Core Institute, and my practice is limited to disorders of the spine. I did my fellowship at the Texas Back Institute in Dallas, Texas. And before that, I completed a 7-year residency program at the North Shore University Hospital and Cabrini Medical Center in New York. Prior to that, I was in a 7-year medical program at the New York College of Osteopathic Medicine, which was 4 years of medical school and an accelerated 3-year undergraduate program. The first time I remember wanting to do something as a child, I wanted to be either a brain surgeon or a heart surgeon. And I think at that age, it was just because it was the cool thing to do. Having watched TV shows and saving lives and all that other drama, I think attracted me to it. But as time went on, I really realized that medicine is a field where you can do a lot of good for people, do something that's fun, challenging, stimulating, and it's relatively respected in the society. So to me, it was the challenge of actually helping people, which I found extremely gratifying. My care philosophy of the patient is really simple. Always doing the best thing for your patient. And as my fellowship director taught me many years ago, the best way to be able to objectively decide what's the best thing for your patient is making that patient as a part of your family and saying, if this was my grandmother, if this was my daughter, if this was my brother, what would I do for that patient? In spinal surgery, many times we have options. Do surgery, don't do surgery, bigger surgeries versus smaller surgeries, advantages and disadvantages. And I always involve the patient very heavily with it, and I try to educate them as best as I can regarding that. But at the end of the day, I always think to myself, if this was my family, what would I do for that patient? And I think as long as you're able to keep that perspective, you will always make the right decision, at least to the best of your capability. The simple thank you means so much that sometimes I'll go home and I'll share some of these rewarding compliments that I get from patients with my family. And I think at least for one of my children, it's really made him think that he wants to pursue a career in medicine simply because of that. Because he sees I get so excited and my eyes light up when I'm telling him somebody said thank you or was so happy and said that you gave me my life back.